Om Swastiastu. We are from SGD B1 from Medical Doctor Undergraduate Education 2020, fourth semester. In this occasion, we would like to present our student project with title Osteochondroma. My name is Manda with 3-digit student ID number 086, and I will start the presentation. Next. So here are the SGD B1 members. Next. The background of our presentation is osteochondroma are the most frequent type of bone tumor compared to other benign osseous tumor. It accounts for 20 until 50% of all benign bone tumors in the world. The incidence of osteochondromas is unknown since many of them are symptomless and remain undiagnosed. The tumors located on the surface of the bone presented as locally benign tumors that likely to grow on metaepiphyseal region of long bones such as distal femur for 30%, proximal tibia 15 until 20%, and humerus 10 until 20%. Diagnosing osteochondroma using plain radiograph oftentimes is sufficient, whereas to evaluate the cartilage cap and identifying complication could use cross-sectional imaging such as MRI, and the management of osteochondromas can differ depending on the patient. Next. So here are the lists that we are going to discuss today. Next.
Okay, thank you for the opportunity. So my name is Amadeus Fernandito Leksana, and I will continue the explanation about the problem formulation. So our problem formulation is what is the general overview of osteochondroma, what is the epidemiology of osteochondroma, what is the etiology and risk factors of osteochondroma, what is the pathophysiology and symptoms of osteochondroma, what is the diagnosis and differential diagnosis of osteochondroma, what is the prognosis and complications of osteochondroma, what is the treatment and management of osteochondroma, and what is the prevention of osteochondroma. So next one is about the purpose of writing. So the purpose of writing is to know the problems of formulation mentioned before. Next one is the benefits of writing. So the benefits of writing is to give general and specific knowledge about osteochondroma and also understand the treatment, prognosis, on prevention of osteochondroma. Okay, thank you for the opportunity. Next one will be presented by my friend.
My name is Bertrand Wijaya with 3 last digit number 132, and I'm going to explain about the general overview. Osteochondroma is described as a cartilage cap benign neoplasm on the external surface of the affected bone and commonly found in the appendicular skeleton and the spine, with the cervical spine accounting for the majority of cases. Osteochondroma may be solitary or multiple and can lead to skeletal deformity, osseous deformities, fracture, bursa formation with or without bursitis, vascular compromise, neurologic symptoms, and malignant transformation. That's all for the general overview. Thank you.
My name is Widya Amritha, and I will continue the presentation about epidemiology. Osteochondroma is a benign tumor that strikes the bone and one of the highest prevalence tumors among other types of benign tumors. The prevalence of osteochondroma reaches 30% of the 50% incidence of total benign bone tumors and 10% to 15% of total bone tumors, both benign and also malignant. In addition, the prevalence of osteochondroma also varies according to the types. There are namely solitary lesion type or hereditary multiple extosis or HME. The incidence of osteochondroma was most commonly found in the solitary type with a percentage of 85% of all osteochondroma cases. Both cases are dominated by male sex. Next. The HME type is classified as asymptomatic with a more severe impact, hence it is easy to recognize at a younger age. It is noted that about 1 per 50,100 individuals suffer from osteochondroma in the Western populations, or 1.5% per year. It being recorded as many as 65% of individuals with a diagnosis of HME have a similar family history. That's all from me. Thank you.
Okay, so I will continue the explanation about still on the epidemiology. So most cases of osteochondroma are found in the knee area based on case data on China. The majority of cases were found in the long bones, namely 50% with a ratio of 2:1 for the lower and upper extremities. Osteochondromas of the lower extremities usually strikes the distal femur, about 30% of the cases, proximal tibia, about 15 until 20% of the cases, and also humerus, which accounts for 10 until 20%. Besides in long bones, osteochondroma can also be found in flat bones, including the sternum, scapula, costae, and pelvic bones, which accounts for less than 5% of the cases. The cervical region itself is known as the one of the highest cases of vertebral osteochondroma, which accounts for 50% of all cases. Okay, that's all from me. Next one will be presented by my friend.
Okay, my name is Devi Savita, and I will to continue the presentation. So, osteochondromas may present as a single lesion or as part of multiple osteochondromas in patients with multiple hereditary osteochondromas. Several studies in the literature indicate that osteochondroma is a developmental lesion as opposed to a true neoplasm due to the separation of cells from epiphyseal growth plate. But recent studies have shown that osteochondroma can actually be a neoplasm due to genetic mutations in either MHE or isolated forms. Primary osteochondromas develop spontaneously without an initiating event, but secondary osteochondromas can develop as a result of childhood radiation exposure or as a result of trauma, surgery, or a Salter risk factor. There are several risk factors that can cause osteochondroma, including genetic defect or genetic factors, bone pain, effects of cancer treatment in children, effects of radiation therapy or overdose, and metastasis or spread of cancer in the bones. Okay, thank you. Next.
Hello everyone, my name is Stevanus Surya with class 3 digit number is 150. So now I will explain to you about the pathophysiology of osteochondroma. Osteochondroma is associated with autosomal dominant mutations in the AXD1 and AXD2 genes that result in both genes losing their functional capabilities. Genes are responsible for the synthesis of hypernatremphate fat, or HS, because they encode glucosyl transferase. Several variations occur in these two genes, such as missense, nonsense, primitive, or splice site mutation. Mutation that occur in the XD1 gene will generate a greater number of osteochondroma, more severe symptoms, and are more at risk for manifesting cancer. Pathophysiological aspect can be reviewed based on the type of osteochondroma, namely non-hereditary or solitary osteochondroma and hereditary multiple exostosis or HME. Next. So for the solitary osteochondroma, occurs as a result of fragments of the epiphyseal plate herniating and penetrating out of the periosteum. The herniation grows and causes the presence of sessile or pedunculated lesions that are often found in the metaphyseal area. For HMA, caused by heparan sulfate deficiency due to genetic mutation of XD1 and XD2 genes, which will disrupt the homeostatic signaling pathways that maintain the perichondrium mesenchyme, resulting in excessive bone morphogenetic proteins or EMP signaling, which triggers ectopic chondrogenesis and osteochondroma formation. For the signs and symptoms of osteochondroma are the presence of a painless lump on the affected bone, numbness and tingling, vascular disorders, kyphosis and spondylolisthesis if spinal osteochondroma is involved, pain when moving the tendon if the osteochondroma is located under the tendon, that is not in accordance with each. Next.
Hello, my name is Dama. So I would like to explain about diagnosis of osteochondroma. So most osteochondroma cases are asymptomatic. They are discovered accidentally through radiograph that actually done for other purposes. But in the other hand, some symptoms may come to the patient which make them need to seek the physician. So first, physician will ask about patient general health and also medical history, or we know as anamnesis. Usually, patient will complain swelling and also pain in the bone area. Continue by physical examination, where there will be inspection and also palpation around complaint area, which is usually long bone or cervical spine, to find any mass, tenderness, or any other abnormalities. And last, to support the information above, physician will ask patient to do diagnostic tests or known as imaging tests. There are several options. Those are plain radiology, CT scan, MRI, ultrasound, nuclear imaging, and fluorodeoxyglucose positron emission tomography, where the first most important one is plain radiology or X-ray to help the diagnosis. And the result from the test may revert to other diagnoses which have similarities to osteochondroma. Those differential diagnoses are Dupuytren exotosis, Tourette exotosis, Trevor disease, periosteal osteosarcoma, Bezier periosteal, and other disease. Thank you.
Okay, I'm Christian with student number 102. I'll continue with prognosis and complication of osteochondroma. Considering the benign nature of osteochondroma, the prognosis is considered excellent. Most of the case, osteochondroma remain asymptomatic and usually be found as incidental findings. Symptomatic osteochondroma are caused by complication, which includes a couple of complications such as cosmetic appearance, vascular, neurological, and malignant transformation. The most common of all is a bumps in ribs or proximal tibial that may cause cosmetic issues. Neurological and vascular complications are usually caused by the mechanical effect of the compression of surrounding structures like nerves or blood vessels. Other rare complications may appear, such as blood flow changes, hypoxia, loss of pulse, venous thrombosis, and aneurysm. The most severe and dangerous form of osteochondroma complication is its malignant transformation. Usually, osteochondroma can transform into malignant type like chondrosarcoma or osteosarcoma. Next.
Hello, my name is Pratama with 3-digit student identification number 061. In this section, I will cover about treatment and management for osteochondroma. The treatment recommendation for patients with osteochondroma is surgical therapy because there is no medical therapy for osteochondroma. Osteochondroma surgery should be performed in certain indications, including 1. Patient complain of pain, aesthetic look, or at site of osteochondroma or complication and a increased risk of malignant transformation. The second, in children, resection of tumor is preferable to be held until skeletal maturity is reached. When performing surgery therapy, complete resection by removing exostesis with consequential removal of cartilaginous cap and perichondrium is recommended. This will decrease the risk of relapse. And if the tumor is asymptomatic, surgery treatment should not be the first choice for the treatment because it can develop a higher complication rates than a tumor itself. There's all my presentation. Thank you.
Okay, my name is Kinan with the student number 210, and I'm going to explain about the prevention. Two facts and observation, as well as related considerations and insights, are used to develop viable treatments and prevention plans. Palovarotene therapy has recently been found to inhibit excessive chondrogenesis in HS deficient cells, which by avoiding the unique regulatory alterations induced by the HS insufficiency, this retinoid agonist strategy could prove to be a successful treatment for osteochondroma prevention in HMA. It is hoped that the pathophysiology of osteochondroma will be fully understood and that the most effective approach for osteochondroma prevention and therapy will be identified. Next.
Hello, my name is Kirana Chandra. Herry. The last 3 digits of my student ID number is 168. So the conclusion is osteochondroma is cartilage cap benign neoplasm that affects the external surface of the bone. Although most osteochondromas remain asymptomatic, several symptoms may be experienced, such as the presence of venous lump, numbness, and also vascular disorders. Osteochondroma is one of the highest prevalence of benign bone tumors. Most cases report having solitary type osteochondroma instead of HME type and affects more in adolescent age before 20 years old, with male sex predominantly. Osteochondroma could develop either spontaneously or due to radiation exposures or trauma. Anamnesis, physical examinations, and diagnostic tests such as prenodiology, CT scan, MRI, and also ultrasonography or any other imaging test could help the physicians to diagnose osteochondroma and exclude its differential diagnosis. It is best for the patients with osteochondroma to undergo surgery, especially when the patients complains of pain or experience any other complications. Meanwhile, in children, it is preferable to delay the surgery until the skeletal maturity is reached. Next. These are the references that we use for this block student project. Next. This is the end of our presentations. Thank you for your time and attention. We apologize if we make any mistakes. We will close the presentation with Paramasanti. Om Santi Santi Santi.